Welcome into To Your Health, and of course we're rounding out our series on National Heart Month, looking at the heart. We started off with how the heart ages, then we went to problems with the heart, some of the treatments, and today, how to maintain a healthy heart. Listen to this good information from Dr. Jackson, who's a cardiologist and a professor at UAB in Birmingham. And we're back with Dr. Jackson. We've gone through a series, and we want to thank you, Dr. Jackson. Very informative. We saw how the heart ages. We saw some signs there may be a problem, and then things you need to do either medically to address that problem or surgically to address that problem. And today, it's all up to you, the patient, to take care of this ticker, right? So how do we maintain a healthy heart?
Great thoughts. It really is your heart. It's not your cardiologist's heart, but we are there. We are your champion. We get really excited when you quit smoking. I was just talking with someone, and I remember patients even 20 years ago who quit smoking, didn't believe they could, and they did. So we're there, cheering you on, and we're there as a resource. So what can you do to protect your heart? Whether you've had a diagnosis of heart disease or whether you haven't, and we're all aging. So healthy things. If your doctors, your primary care, your cardiologist say, I'm worried about your cholesterol, I'm worried about your blood sugar, diabetes, you should be on these medications, listen to them. Read up on the medications. Great websites, again, American Heart Association, American College of Cardiology. Know what you're taking. Ask great questions, but they're doing this because they really want your risk factors to be as modified as possible. The other thing you want to do is lifestyle. Medications don't replace lifestyle. I think about a good meal. You're not going to have one ingredient in whatever you're cooking. You're going to put ingredients together, and that's exactly the way I think about cardiovascular prevention. Regular physical activity is amazing for protecting our heart. It also does well for cognitive health, for brain health. That doesn't mean you have to go to the gym and be, lifting weights and do it. You want to do the things you enjoy. Walking is a great exercise. That is, if I'm super busy and I only have time for a couple 10-minute walks, we know from the nurse's heart study and the physician's heart study for years that even putting together little bouts of exercise is better than nothing. So walking is great. And you don't have to walk for an hour. You can do little bouts. Healthy diet, okay? You don't have to be perfect. I certainly am not. But
Nor am I.
trying to make sure that you're eating a mixture of colorful vegetables, fruits, making your meats lean meats, trying to have healthy oils. That means that things like olive oil, oils that are liquid at room temperature and not solid, are much, much better for you than saturated fats. So really, healthy dietary pattern, most meals, not overeating, trying to maintain a healthy weight, regular physical activity, getting a walking partner, getting out there, and, helping each other. And then healthy sleep, we know, is tremendously important. So if you're having problems with sleep, think about how can I turn off the TV or get rid of the phone before I'm sleeping, making sure you're getting adequate sleep, and talking with your doctors about things that they might have learned from other patients or from research in order to make those lifestyle behaviors optimized that really complements any kind of medications you're on. It doesn't replace them, it complements them.
And protein's very important in your diet also, isn't it?
Yeah, it's always interesting to me to see the ebbs and flows of what we are thinking about in terms of different components of our diet. And when you look at that, the research that I really like to see, and I think makes sense, is around a dietary pattern. So when we think about proteins, I can remember when I first trained, it was all about, low fat, and we didn't even talk about proteins that much. Now we talk a lot about it. Protein is really important. It helps us with our muscles, and being strong and not falling is important, even if it's not directly affecting your heart.
That's right,
It
especially as we're
affects,
aging.
yes, exactly,
Yes, yeah.
exactly. It affects all of you. So, when you're thinking about protein, think about different sources of protein that you can get. Legumes, corn and beans together,
Hmm.
as well as if you're going to go for red meats or other types of meat, to try to make them on the lean side so you're avoiding that saturated fats.
Well, that's some great information. And listen, I want to thank you. This has been a great series during National Heart Month, and you are a American Heart Association expert, I've been told, of course, as well as a professor of medicine at UAB and a cardiologist. And Dr. Jackson, I just can't thank you enough. You're very knowledgeable and you're very easy to talk to, by the way.
Well, it's my pleasure. You discussed all the things that I care deeply about and have a lot
Good.
of fun talking. So it's my thank you to you for allowing me to discuss these things with you.
And thank you, Dr. Jackson. Thank you for the entire series. She did a wonderful job, and it's great to have people like this in the state of Alabama. Maintain a healthy heart.